there is a relatively new treatment that is still very gentle but promises great results. Joining us this morning is board-certified Dr. Gil Lee of Changes Plastic Surgery Center. Now, this is ultrasonic energy liposuction. If you would please explain how it is so different than regular liposuction.
Sure. Good morning.
Good morning.
This is called the VASR technique, which stands for vibration amplification of sound energy at resonance, which is a big name for ultrasound energy. This is a probe. The energy gets generated down the probe, and it causes the tip to vibrate at 38,000 times per second. Now, that doesn't hurt your skin or nerve or blood vessel tissue, but when you hold that up against fat, it causes the fat cells to implode, and it releases the fat.
So basically, instead of what we think of liposuction is just, in very crude terms, sucking out the fat, this in effect kind of heats and breaks up the fibrous material or the fat cells?
Right. It actually vibrates it so quickly that it causes the cells to break. That releases the fat, and then at the second stage, we can suction it out.
Let's put it to the test.
Well, this is an interesting thing. You can just show that when the probe is on, it doesn't hurt your skin.
Okay.
And you can't hear anything because it's so high frequency that only dogs can hear it. But if you take a tub of butter, which I would think most of us would agree is fat, and you hold it right there, if you get a close-up of that fat, it just melts away that fat. And this is hard butter just out of the refrigerator, so you can just get an idea of how gently that technique can melt the fat. It is really good for removing fat from very fibrous areas such as breasts, back, flanks, tummies.
But is it gentle enough to get the areas of, say, your knees or your neck?
That's what's nice about this one over the ultrasound that we had of the past years, is that this one is maybe a quarter to a half of the energy, but twice the effect. It's a really new advancement.
Many people sitting at home may say, well, that's just butter melting, but let's try it on something a little bit tougher. You brought some chicken in.
Sure. This is some chicken fat, and I don't know if anyone can see that with the camera, but let's just put that right there. And you just turn up the energy a little bit. And you won't hear it, but basically what we're doing is just melting the fat right through.
I'm seeing that. I'm hoping people can see that. Yes, you can
what
see
you
that
see
at
is
home.
that little mist off. The mist you're seeing off the top is actually just the fragmentation of the fat. So.
Is this a slower procedure than regular liposuction, as we know liposuction to be?
You know, that's an interesting question. I've been doing liposuctioning for 15 years, and initially we started with the 2-meson technique, and then we went about 7 years to regular liposuction, and then now we've moved to the VASR technique. And this technique will actually be about 20% faster. The reason why is with these small probes, they're so efficient in melting the fat that you can melt it faster than a standard ultrasound machine. And now, because inside under the skin, the fat is like melted butter, we can come in with these fine cannulas, and these are newer version cannulas. These cannulas have vents in them, so there's not as strong a suction on them, and so the tissue comes out much faster with less trauma to the tissue. So that means less nerve damage, less vessel damage, less skin damage, and a quicker recovery with less swelling and bruising.
I'm sure a lot of patients who've been through liposuction surgery know how painful that recovery time can be, so any kind of relief would help. If you are not quite ready to make a phone call, you'll see a website on your screen. It's changesplasticsurgery.com, but there is also the number 858-720-1440. Dr. Gilbert Lee, again, board certified. Thank you so much for spending some time and showing us this new technique.
Thank you for having me.
Appreciate it.